So you're using stem cells and you're injecting them into patients. So what are the different categories of patients you see for this?
We use stem cells for shoulder problems, tennis elbow, golfer's elbow, hip arthritis, hip tendonitis, knee arthritis. I've been practicing for years. In the first several years of my practice, I was an interventional physiatrist, so I treated a lot of musculoskeletal disorders, and really all we had was exercise, rehab, and cortisone injections. The problem is all that did was just kind of try to calm down the tissue and strengthen around it, but it didn't really heal the problem. So the stem cells, the exciting part about them is they actually heal the injury. They promote healing and restoration of normal function, and it's the results are way better, much better than anything I saw with cortisone injections. Matter of fact, I don't really use cortisone anymore. I tend to.
So for people with shoulders or knee pain, you're doing these injections?
Yeah,
and those things are going away in certain people?
They are going away. We use ultrasound guidance, so we put in a very specific spot. So for example, if you have a partial rotator cuff tendon tear, I use ultrasound to identify the partial tear, inject the stem cell solution. What I mean by that is it's not just cells, it's stem cells with other proteins and other growth factors, other part of the healing cascade. So it's just sort of this milieu of cells, we call it orthobiologics, that we inject in there to help heal, not just quiet the fire, but actually regenerate the tissue.
What kind of results are you seeing?
We see excellent results. Not everybody gets 100% relief, but typically patients will decrease their level of pain. So I had one patient who was in her 70s and she had knee arthritis. We injected her knee and she was pain-free. And she went from kind of struggling with activity because she was not a 70-year-old lady who was ready to sit down. She wanted to be active. She was a go-getter, right? And she was hobbling around and just a little bit uncomfortable and really frustrated her. Took the pain away, and she kind of got back to what I'd call a very active 70-something-year-old lifestyle, and she's happy. And now we're working on the other knee.
So when this stem cell therapy came out, especially for injured, shoulders, knees, et cetera, tennis elbow, were you skeptical with your training as a physiatrist?
I really wasn't, because there was some reasonable data that was being presented, and I was frustrated with cortisone shots. They can only offer so much. So I was hopeful, and fortunately, I think it's proving to be a reasonable treatment. It's not a cure-all for everybody, but there are patients who are getting better with stem cells and even PRP.